I came on live today, but a little bit late. I had so many things to do today, so that's why I'm coming on live a little bit late. But join in. Let's discuss. Let's talk. Let's have some discussion, you guys. Join me. Join me. If you join, please like the video. You're welcome to my life. You are all welcome. Welcome. What's this? Hi, Jude. You are welcome. You are definitely welcome to my life. These are ways to do it. Okay. How are you, Jude? How How was your day? I hope you had a great day. Thank you for the likes. Thank you. You guys are welcome. I decided to try a new effect on my face. My topic for today, I don't really have a main focus for today. I just want you guys to bring up topic for discussion, and then we discuss. We'll discuss. Thank you guys so much for joining and for liking. Really appreciate. Please continue tapping on your screen for me so YouTube can continue pushing the video. The effect is good. Much. Thank you. Thank you for that. I just wanted to try something today. How was work today? I'm not working. I'm learning a new skill, so classes were okay, kind of okay. We learned a lot today. I'm applying for other places, but for now I'm focusing on learning this baking skills. For now, applying to other places, looking for ways to get jobs. Yeah, that's basically it. Of course, I know first aid. I think first aid is even taught in secondary schools because it's something that is, let me say, life saving. It helps in case of an emergency. You give that person that first aid first before maybe other treatments can be given to that patient. So I think they teach first aid from primary school because secondary school, because that's where I heard about first aid first. The first time I heard about first aid. You guys should please like the video. Thank you so much. You are welcome. Hi, Salim. You are welcome. You are all welcome. Oh, you are welcome. My door is even open. Wow, you guys are trooping in today. Hey. Today I don't even have any topic to discuss. Oh my god. You guys should bring up topic for discussion. I should bring up topic for discussion. I don't have a topic. I just decided to come on here to show you guys my face. Salim, how can you love someone that you don't know, you haven't met before? It's not possible. Fly with Captain. What's up? How are you doing? What's up with you? Kento, you're welcome. Hi, you're welcome. You guys are welcome. Something like that. Oh my god. Let me scramble up for the topic. Yeah, from Kenya. Okay, you're welcome, Frederick. How can a nursing community support aging population? In what aspect do you mean? In what aspect, like, do you mean how can we support aging population? I don't know what my neighbor is doing. I'm trying to listen closely to know what they are doing. I don't know what they're doing. You guys, give me a minute. Anyway. Are they live? Anyway. My audio. Okay. That's my brother, you guys. Imagine in with them topic that very bad joy Rabashi. Salim, you say I should give you a high five. Is it virtual high five? How? Join before ma'am. But then when me na at this course about for I don't read finish today. Okay, don't banfa. Yes. Omunguta more self. You know. Or carrots. Yes, I bought carrots. I got them. Magune. Yeah, I was asking you, like, support aging communities, how, aging population, how? In what aspects? Is it in caring for them or support them how? How do we support them? In which aspects? I was asking you, you didn't answer me. Jude. My brain is totally blank. I'm just thinking of what to discuss. Hi, Sam. Thank you so much for joining. Peace be unto you too. You're welcome. In caring and otherwise. If we can support them by caring for them now, we already do a lot for them. Most nurses work in care homes, nursing homes. We support them by caring for them emotionally, physically, medically. We support them by caring for them because sometimes they do feel like a burden on their children when they come to that nursing home. So you have to make them feel at home. You have to like talk to them, make them feel comfortable so that their emotions will not be all over the place. So you are basically caring for them emotionally also in ways that maybe their children cannot care for them. And also physically, like you are helping them do a lot of things. Konde Kenga. Hi, you are welcome. are welcome. Sam, hi, I can see you. I can see you. You guys. The question wey dey answer kwa too much. You wan know the too much. How do you learn? How do you answer for the bay? You said, how can this new age technology help elderly individuals? It can help them in so many ways, I believe, but that is not even for me to answer because I'm not into tech. I can answer with the one I know. Like, there are some wheelchairs now that are, they don't need a person to push them in the wheelchair. So that is a technology-based wheelchair that can just help them to move around without the assistance of anybody. It helps them in that way, in mobility. I think there are so many other things that technology has been able to create that has been helping elderly individual. Why are you so interested in elderly individual? How old are you, Jude? That you are just asking all these questions back to back. Kumar, how are you? I'm good. I'm good. How are you? I hope you are good. You guys, I just joined this life. I don't even know why. I felt like I needed to be here. Maybe somebody was. Hi, Shindu. Shindos. I don't know how to pronounce. My no go butcher person. You are 68 years old. Wow. And you can. Oh my God! What? Okay, you are welcome. Bootsy, you are welcome. You are all welcome. Please like the video. Double tap on your screen for me. Let me TikTok me that too. Did double tap? Did double tap? Check out now. Oh, my tap. You better tell me that. Eh? How can a nurse help old age people manage chronic pain? You that Julema Nurse Kaka. But how can a nurse help old age people manage chronic pain? Basically, forming a pain management plan for them with the help of their doctors. And also, there's this technique called a distraction technique. Like, you distract the patient or the person from the pain by using other activities, be it swimming, like water, because the water temperature is quite different. So when your body hits that water, your nervous system will shift from the pain to the temperature of that water, so you can help. Also, distraction techniques like focusing on their hobbies, doing things that they like and they enjoy. All these things can help them with their pain. And also pain management, like pain medications. As I say, they have to discuss a pain management plan with the doctor so that it can be executed by the nurse with the help of the nurse. Thank you for subscribing. I really appreciate. I don't know much about morphine. Where we worked in, where I studied in India, they didn't use, well, as I was practicing there, I didn't see them use morphine in my presence. Or maybe it's because I was a student nurse, they could not like give me to go and give to the patient, you understand? But the only place I've seen morphine being given to a patient was in Nigeria, in UNTH hospital, in a national teaching hospital. That's where I saw morphine being administered to a patient. It helps a lot to calming the pain. Like it helps, it targets pain very well, but it's also addictive. Understand? Needs to be like managed properly. If not, the person can become addicted. Hi, Daddy B, you're welcome. Jude, how can a nurse prevent falls in elderly? You just have to monitor them properly because elderly, they are kind of free. Or you can also encourage them to do exercises. Simple basic exercise like walking around for like 10 minutes. It helps to strengthen their bone, to increase the intake of calcium in their diet. Understand? So it can help to strengthen their bones because they need their bones to be strong. To also increase intake of protein for their muscles. A strong person will not worry about falling down. You understand? A strong person will not worry about falling down. As you are now, well, not you, as I am now, I cannot worry about falling down anyhow because I know my bones and my muscles are strong. They are well to do because I eat enough protein, I exercise, I take enough calcium. Same goes for old people. Just because you are getting old doesn't mean you should stop doing exercise. It doesn't mean you should stop eating right. It means you should. It even emphasizes on the fact that you need to eat right. You need to eat well. Jude, your questions are very, very interesting. They are very, very, very interesting. Falling in love with me. Hello from Guyana. Wishing you a prosperous 2026 filled with love, happiness, and great health in abundance. Never give up and keep your eyes on the prize. Oh, thank you so much, Gerald. Really appreciate your motivation. Thank you. Thank you so much. You're welcome to my life. See that face. You say, how can nurse help old people stay mentally sharp with all these chemical foods we are eating these days? Number one, everything is a chemical. Sugar is a chemical. Salt is a chemical. Everything is a chemical. You understand? It just depends on moderation. Too little is bad. Too much is also bad. And also how you yourself can help yourself to be mentally sharp is by exercising. When I mean exercise, I don't mean you should go and start lifting weights. You can start small, from walking around to jogging to jumping jacks, just simple exercises. Then you also have to stimulate your brain cells. You have to read. You have to be curious. You have to ask questions. Because if you stop reading, if you stop learning new things, your brain cells dies. It dies. Yes, if you stop learning new things. In fact, you become like a zombie, as they take the talker. You become a zombie. So you also have to help yourself. We can help you in our own way, but you have to help yourself. You understand? You have to exercise, eat right also. What you eat also reflects in your mental health. What you eat also reflects in your mental health. You have to eat right. You have to read. You have to keep your brain fresh by reading. Educate yourself on things you don't know. Understand? Also, just live life. Live a very happy and fulfilling life. Understand? This these are things that we cannot help you with. These are things that you have to do yourself. The only way I can help you is by telling you this now. Like, I can tell you to do this, then you do it. That's the only way me I can help you as a nurse. And it's left for you, or left to you, to put it into practice. That Veda, it's so easy to develop a crush for a nurse. Yeah, we are good people. We are kind people. We have empathetic and sympathetic face and emotions. So it's quite easy. Yeah, it's true. It's easy. I can see how easy it might be. But not all nurses though. But some. Hi Jude, you are welcome. You are the question asker in this place. The question asker. Wow. You said, how can nurse help old people maintain a healthy diet with all this sugary food we eat these days? As I said before, you are the one that will help yourself. What I can do as a nurse is to tell you what to do and what not to do. Then it's left up to you to do it or not. As I said before, yes, sugar is bad. Too much of sugar is bad, and too less of sugar is bad, because your brain actually runs on sugar. Your brain runs on sugar. It needs it to function. You know, people that have hypoglycemic shock, or let me say hypoglycemia, like they haven't eaten for quite some time. They haven't eaten it. You might see they might faint. Like, they will faint. That's because there's no more sugar in their body. Their brain is shutting down. Everything, let's just shut down. So this person will know that we mean business. Sugar is not a bad thing. It's just in moderation. And besides, maintaining a healthy diet is not for us to come and start forcing you. It's something you need to do by yourself. We can tell you to eat healthy, eat foods that are rich in calcium, iron, vitamin A, vitamin C, iodine, magnesium, potassium. Eat good food, eat healthy food, eat whole grains. I know there is processed food, but the lesser the processing, the better it is for you. Eat food that are whole. You understand? All these things I'm saying is just left for you to practice it. And always be ready to check your sugar level. Be ready to check your sugar level. If it's once in a week, once in 2 weeks, check your sugar level. As you're getting old, yeah, it's quite hard for your body to produce insulin. So you have to be checking your sugar level every 2 weeks or every 1 week. If you're someone that has diabetes, once in a week, or even every day. Have you ever had a crush for a patient? Not really. I haven't. Maybe I haven't seen any patient that piques my interest, but I haven't. I don't think you even have a crush on a patient. Most of the times, we nurses, we don't look at patients with that kind of eyes. We look at them with eyes of pity, like, oh my God, this person is passing through a lot. This person is going through a lot, you understand? That's the kind of eyes we use to look at them. We don't use the kind of eyes you're talking about. Maybe for doctors, yes, you might have a crush on a doctor. But for patients, no, not really. What are signs of depression in older age? Signs of depression in older age, when an older person or elderly person stops engaging or stops doing that thing that he or she likes doing. let me say if it's an elderly person that loves eating or that loves cooking, and the person starts withdrawing him or herself, then you know that there's a problem. There's a problem that maybe something is wrong somewhere. You understand? If the person start withdrawing, sometimes the person might start complaining a whole lot and start telling you that, oh my god, you guys are doing so much for me. I just feel like a burden. I feel like there's nothing I can do for you anymore. That kind of stuff.